5 little known reasons why you stink. Well, hey guys, body odor is really distressing for people to try and figure out where it's coming from, what's causing it. And in today's video, we're going to dive deep into 5 little known reasons why you have body odor. Now, to be frank, body odor, the medical term for which is bromohydrosis, is actually perfectly normal. You're supposed to have some type of odor, and it comes about as a result of breakdown of sweat, sebum, and keratin by bacteria that normally live on our skin. A lot of things can influence body odor. Where you live, your overall health, medications that you take, dietary supplements that you take, and of course your age. But there are also a variety of other conditions that can lead to noticeable body odor. So number 1 is something called trichomycosis axillaris. This is actually a bacterial infection of the underarm hair. You get these little yellowish, red, brown concretions that you can visibly see on the hair. It also can result in discoloration of your sweat, like you may find that your sweat is kind of reddish brown and is staining your clothing. And it does lead to a very foul odor because that little bacteria actually breaks down testosterone in your sweat to lead to a strong odor. This condition can happen in both men and women, but it's a lot more common in men, probably because women in general tend to be removing underarm hair more so than men, although of course that's not always 100%. Now, while this is called trichomycosis axillaris meaning underarm hair, you can also develop this in other body sites where you have hair, like in the genital area, the scrotum, the intragluteal space. It's a lot more common in places where it's humid, you have a tropical climate, it's hot, you're sweating more. This leads to a favorable environment for this type of bacterial infection of the hair strands. And of course, it's happening in the folds where we have a lot of moisture trapping, like under the arms and then, in the genital area. One interesting thing about this is that if you take a special lamp called a Woods lamp and turn off the lights, turn this lamp on, and look, this bacterial infection will often fluoresce yellow. This isn't a life-threatening condition, but obviously it is bothersome to people to have this, to have the odor associated with it. In order to get rid of it, you basically have to, well, shave the hair, so hair removal. And also there are topical antimicrobials that may be prescribed to clear it up as well, but hair removal is key. Now, it can come back, and a way to prevent it from coming back is consider consistently removing the hair in that area if it's really an ongoing problem for you. But you also might consider washing the underarms with a benzoyl peroxide acne wash. As a side note, this can help honestly with a lot of body odor issues in general because it cuts down on bacteria on the skin that break down eccrine sweat and cause odor, or bacteria that can lead to, well, this little infection of the hair under the arms. The way to use it is just lather it under the arms like while you're in the shower, let it sit on the skin for a few minutes, and then rinse it off. You can do this a couple of nights a week and it will really help. Now, it can be on the drying side. If you find it to be too drying, you may choose a benzoyl peroxide wash with a lower percentage of benzoyl peroxide. So for example, benzoyl peroxide is often at 10% strength. They also make it in 4% and 2.5%. And also try and put on a little moisturizer to the underarms after you rinse it off and you get out of the shower to help cut down on dryness and irritation. The other reason why you have body odor is maybe you are just producing too much sweat, hyperhidrosis. A lot of people struggle with this, either their palms, the soles of their feet, the underarms. And I have videos on hyperhidrosis. That's the medical term for excessive sweat. What will end up happening is, like in particular in the underarm area, that's excess eccrine sweat, which is produced to cool your body. It accumulates there, and the bacteria that live on your skin break it down, and that contributes to odor, also contributes to odor in your feet. You can take measures to reduce output of sweat, such as using an antiperspirant. I recommend using an antiperspirant at nighttime. Most people use it incorrectly. It's best to use it at at nighttime. It works better that way. Even if you take a shower the following morning, it doesn't matter because the antiperspirant is working down in the sweat glands. So anything left on the skin surface when you wake up the following morning can be rinsed off, and the antiperspirant is still effective. And that'll help cut down on the outflow of sweat. Now, of course, you can buy antiperspirants in the store, but what about if you're dealing with a lot of sweating on like your feet and it's contributing to foot odor? Might I suggest this antiperspirant lotion? I purchased this several months ago from Amazon. Highly recommend it. It's called Sweat Block. You can also get it at Walmart. It's an antiperspirant lotion that you can put on your hands, your feet. It does feel a little strange going on, but let me tell you, it really, really works quite well. Again, put it on at night before you go to bed. That will help. And likewise, lean into a benzoyl peroxide wash, whether it be on your feet, under your arms. This, again, will help cut down on the bacteria that is breaking down your sweat and leading to odor. Now, if you deal with hyperhidrosis, talk to your healthcare provider, because there are certain underlying medical conditions that lead to hyperhidrosis, such as a problem with the thyroid gland, for example, among many potential issues. Or maybe it's related to a medication you are taking. But a lot of people simply have hyperhidrosis. Like, there's no reason other than that's just how they were made. There are various treatments for hyperhidrosis, many of which I have covered in dedicated videos, such as a medication called glycopyrrolate that helps cut down on sweat output, iontophoresis for the palms and soles, and there's also Botox, a neurotoxin, which in many cases can be covered by your insurance for the treatment of hyperhidrosis. So check those videos out. I will link them down below in the description box where I go into detail there. Taking measures to keep the skin cool and dry and to reduce the accumulation of sweat on the skin surface are key here. Changing out of sweaty clothing, sweaty socks, letting the skin air out to allow for evaporation of that sweat so it doesn't accumulate, all really helpful here. Okay, number 3 is a reason why your feet might smell particularly foul. It is a bacterial infection that can happen on the feet. It's actually common in like teenage boys, but really anyone can get it. It's called pitted keratolysis. Risk factors for getting it are, well, sweaty feet. So it might be something that arises secondary to you just having, well, hyperhidrosis like we just talked about. Also, just being in closed-toed shoes, not changing your socks out regularly contributes to the risk as well. But with pitted keratolysis, what happens is you get an infection of the bottoms of your feet, and it's called pitted because the bacteria break down the proteins in the outermost layer of your skin, the keratin proteins, and they cause these little pits. As they break down the keratin, it releases these sulfur compounds, and that is what leads to the strong odor. And the skin often might feel kind of slimy, look shiny. This can be treated with topical antibiotics, but also a way to help clear it up and prevent it from recurring is to use, well, benzoyl peroxide wash. It really can help quite a bit. Alternatively, there's an antiseptic wash that you can buy as well in the pharmacy called chlorhexidine, which, as a side note, is another way to just cut down on body odor in general, is to use chlorhexidine to areas like the feet, the underarm area. As like benzoyl peroxide, chlorhexidine can help cut down on those bacteria that lead to odor. You want to be changing your socks frequently. Make sure they're dry, your feet are dry. Maybe consider using a powder to absorb excess moisture. And again, the antiperspirant lotion Sweat Block can help as well once it has cleared up to cut down on the sweat that leads to possible recurrences. All right, number 4 is something that a lot of people search out information on online. It's like a popular search topic, and that is foods that lead to body odor. Foods that lead to body odor, there are actually many, or I would say they don't necessarily lead to body odor, but they contribute to your overall odor, and you may be bothered by them. Consuming a lot of allium vegetables can lead to or contribute to your overall odor. These include garlic, onions. These contain sulfur compounds, which will contribute to odor. You've probably heard of asparagus making your pee smell funny. It also may contribute to body odor as well. It has a compound called methanethiol that is thought to play a role in body odor. Certain spices also can influence body odor, like curries, cumins. They can, come out in your sweat. mixed with your sweat, it gets broken down by bacteria, and that definitely can contribute to odor as well. And alcoholic beverages can definitely make you smell stronger than you might like, especially if you drink a lot regularly, because alcohol's breakdown compounds get released into the sweat. You can contribute to almost kind of like a sweet scent, but when admixed with your background sweat and the breakdown of that by the bacteria, definitely can lead to a very strong odor. And red meat is established to contribute to body malodor. Eating a lot of red meat in particular is thought to be related to the fatty constitution of red meat combined with sulfur compounds. They've actually done studies on people who eat a lot of red meat, and they are perceived as less attractive in terms of their odor. So that's another thing you might want to dial back on, is the red meat if you are concerned about body odor. Last but not least is actually probably going to come as a huge shock to you. It's something no one talks about. Like, I never hear anyone talk about. It's actually a mental health condition called olfactory reference syndrome. This is thought to be kind of maybe a subset of body dysmorphic disorder or obsessive compulsive disorder. There's some overlap. Basically, the individual is preoccupied with a perceived body odor that is not identifiable by anyone else. They are overly preoccupied with the concern that they have body odor, that they are offensive to other people. It causes them extreme distress, social anxiety. They isolate themselves. It's very distressing to go through. I have had patients with this. You do a complete workup to make sure there aren't any other causes of body odor. You don't smell the body odor. Other people report they don't smell any odor coming from them, but the patient firmly believes that they do have a strong odor, and they take a lot of measures such as bathing multiple times a day, frequently changing their clothes. It can become quite disruptive to their daily life, and they are also doing a lot of behaviors like always smelling themselves. And unfortunately, they oftentimes will misinterpret other people's behaviors as a reaction to this, odor that is not there. For example, if they're around people and someone happens to open a window, that person with olfactory reference syndrome is going to interpret that as, oh my gosh, they're opening the window because I smell bad. And so this is, not a true body odor. It is a false belief. These patients need help with their mental health, behavioral therapy, and possibly medications to help with their condition, because it's really a distressing thing to go through. All right, y'all, so those are 5 reasons why you stink. I hope this video was helpful, as well as giving you some tips and tricks to address these things. But by no means is this meant to be a comprehensive, every single reason why you could possibly have body odor. As I mentioned, there are a lot of things that can influence it above and beyond the scope of today's video. I just wanted to cover these 5 maybe lesser known reasons. And but keep in mind that things like medications, age, underlying health conditions, all can also be playing a role in body odor as well. All right, y'all, speaking of body odor, on the end slate, I'm going to link my recent video on hygiene mistakes to avoid. So check that one out next. But if you guys enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.